Welcome back to Gary Brown Forging On Rehab. Anyway, yeah, I'm done for the day. I think it's been a long day. It's about 7:25 here right now, evening, and it's cooled down a little finally outside. And in here in the shop, my thermometer says it's now down to 98 inside. No, 88 inside the shop. Was up to over 90, but it's down to 88. And like I said the other day, it's like, you know, somewhere around 623 or 32% humidity. It's a ballpark, you know. Seems like I'd be used to humidity after growing up in Florida and moving. I always lived in the South, so I should be used to this humidity, Southeast. But I'm not. Anyway. What I want to talk about is the reason I haven't been around much. One is my sciatica came back. I don't know if you ever had to deal with that. Just pain shoots down one leg. Real pain in the leg, actually. So the problem with the sciatica, I'm thinking it comes from my twisting when I walk. I limp and twist real bad. That's because I haven't wore my joints out, but I've damaged them so bad years and years ago. I mentioned before, I think in a previous video a long time ago, I tore out my ACL on my right knee in a motorcycle wreck. But back then they just, it was back in the 80s, mid 80s. Back then they just x-rayed my knees, said they were sprained, sent me home. I'd fall down all the time for a while until I strengthened that leg up, and I used to fix sinkholes and, you know, lift houses with my bare hands. God, not really. Okay, now rain's coming. Sweet. Cool things off. Hopefully you can still hear me over the rain and the fan up. Yeah, it's right there. Fan. So anyway, I was always pretty strong, and so I strengthened the knee up and never thought anything more about it. 15 years later, I had to, let me get that a little closer. There, 15 years later, I had to, my knee started locking on me, and then they did an MRI and said my ACL's been gone so long there's nothing left of it anymore, and I tore out half the cartilage, so they went and cut that half cartilage out. I thought they could repair it, but I found out you can't repair torn meniscus or cartilage or whatever you want to call it. I guess it's meniscus, because there's no blood supply to it, so you can't do that. So anyway, so it's just been getting worse and worse, and I thought that was my whole problem. About 12 years, I'm just guessing the time, 10, 12, 15 years ago, I fell real hard on my right hip, so bad that I could barely walk for a couple months. But eventually I got over it, and I went to the doctor, and they said it was either a bone bruise or a compression fracture. Not much I could do other than they said it'd aggravate arthritis and all this. Well, now I'm at the point where my hip is, they said within another 10 years it would completely seize up. And hook this back on. And so what happened was when I jammed it in there, because there's all this arthritis built up, my other one's clean as a whistle, but my right hip is all built up, and when they redid my rotator cuff last year, they ground off all those spurs on my rotator cuff. And I said, can't you just go in and grind off those spurs so that my joint will come up and move again, since it's hitting on them spurs and stop? And orthopedic said yes and no. He said we could do that if that's the way it was, but with my hip, I jammed it in so far that even if they ground them off, I'm still hitting in the joint. So all I can do is get it replaced, which is happening this month, end of this month. Won't be as long of a rehab and out of the shop as it was with the shoulder. I was out for 8 months with that. So I'm gonna get the hip done. Found out a lot of your knee pain is can be felt from hip problems. A damaged hip is felt in the knees, what the orthopedic said. So one thing, if they have a choice, since both of mine's on my right leg, my hip and my knees destroyed, since both of those are bad, they prefer to work their way down. And they said that if they do my knees and I still feel in pain, it could be from my hip. So they won't know if it's something with my knee or something with my hip causing the knee to hurt. So that's why they're going through with the, we're going to do the hip. Plus, when you have, later on, when I have to have my knee replaced, which I hopefully I can put off for a while, your rehab uses a lot of hip action for when you have to rehab your knee. So they want to get your hip working correctly so they can get the knee right. But in the process of being just, decades of limping and, well, not decades, I haven't really been limping hard, but maybe the last 4 or 5 years or more. But it all started, it's been a gradual thing, it's gotten worse. But it used to be my right leg was always stronger than my left because, you're right-handed, everything's on the right side is usually stronger. And, but now I got so much atrophy on my right leg that my left leg looks like it's, twice the size of my right leg. When I walk away from somebody, they're like, my right leg looks all skinny. My left leg's, strong. But that's also caused another problem is the limping and twisting, I think, has caused my hips and back to get out of whack. Because if I lean on my right leg more, because I'm always standing, putting my weight on my good leg, my left leg, and that makes my sciatica hurt more down my left leg. If I lean more on my right leg, it eases the pain up. So I'm thinking a lot of that sciatica stuff I've had off and on for the past couple of years has come from the twisting action. So I'm hoping, I'm just now getting to where it's like I had to sit down now. I was actually doing pretty good through the shop today. Sciatica wasn't really hurting me much. And then it started aching more and more and more. I guess I just done too much. But they told me that since I've favored my left leg so much over the past years that I've actually just wore the meniscus out. It's almost bone on bone, other than it's got a little thin layer. And so they say I'm a candidate now for a double knee replacement. That's going to be a while if I can get away with it. I had enough surgery. Had this, like I said, this was just arthroscopic when they redid my rotator cuff. So I'll probably, when the time comes, I may do some videos like before. Like I said, this is almost, this is August the 3rd right now, and I don't go in for surgery till near the end of August. So, and I got to go like a week or two before that to see the doctor and get preliminary checkup and go to a class on hip replacement, because if you don't do stuff, if you turn too much one way, you pop your hip out. If you lean too far forward, you pop your hip out. So I asked the doctor if I could forge my own hip. He laughed, said no. So anyway, that's just what's going on. So I'm back in the shop now. Like I said, the sciatica, the thought of standing out here on concrete was just too much for the sciatica. So last 2 or 3 weeks, I hadn't been out here much. And I've been doing woodworking today. I've actually been working on my woodworking bench that I've been working on. And so I haven't done any forging or welding. I got some welding projects coming up pretty soon. I've got a forging. I actually got three or four forging projects I've got to get for other people, but I hope I can get them done before I have surgery, but I may not. But I'm hoping, I could be back out here 6 to 8 weeks after surgery or something. I don't know. I can't drive for 4 weeks or something like that, but I've heard a lot of people just, within a week or two are just almost back to normal. I just like to know what it's like to walk without limping. That'd be just phenomenal. So anyway, I know I'm old by a lot of YouTuber standards, but my joints would be good if I just didn't destroy them when I was 20 and 30 years old. So, what do? You pay for it now. I see all these guys on these motocross and rodeo riders and the skateboarders and tumbling and wiping out, and they could shake it off, limp for a while, get back. And I think, yeah, that was me too. I wasn't doing those kind of things, but I was doing my own things. And they'll be hurting later, but they've advanced a lot in joint replacement. Maybe they'll continue on. I'm going to go in and take a shower. I hope you all have a blessed day.